Welcome back to Market It with Atma, where we share the tips, tools, and strategies to help your business be successful. Today, we have on the show a very special guest. He is the owner of Aesthetic and Implant Dentistry in Midlothian. His name is Dr. Noe Jaramillo. Welcome, Dr. Noe, or Dr. J, right?
Yeah, patients call me Dr. J, so thank you.
Okay, you're welcome. Now, I'm so excited to have you on the show because you have a great story. Can you tell us kind of how you got into the industry and what your passion was to get you involved in redefining people?
Yeah, so I started my career in dentistry at the age of 18. I was a dental assistant for approximately 10 years prior to becoming a dentist.
Okay.
So I started working here at a general dentist who offered oral surgery services for different dentists in the Metroplex.
Mm-hmm.
So we specialized in doing wisdom teeth extractions, dental implants for different doctors in the Metroplex.
And you were naturally just kind of good at it or had a natural interest in it? Because to own your own business, you have to be pretty good at it, right?
Yeah, for sure. So the doctor I was working with, Dr. David Roberts, who's one of my mentors currently, he highly encouraged me to become a dentist. You know, we had a talk. I was 18 at the time, and we were driving back from Melissa at the time.
Mm-hmm.
And we were going back to his house that's where we would meet up.
Mm-hmm.
And he told me, you're pretty young, you're good at, you learn really quick, you do things well, you're a pretty sharp guy. He's like, do you want to be a yes man or do you want to be the boss? And I was like, what are you talking about? And he's like, do you want to be a yes man or do you want to be the boss? I said, well, everyone wants to be their own boss.
Right,
and
of course.
And so he said, you have potential. I see that you can do this. You're good at this, and you have an interest in it. And so, he talked about dental school and the process and all that. I said, okay,
give it a try.
So that was like early on in the summer, and then 6 months went by, and he's like, have you started looking into college?
Oh, so he saw something in you.
Yeah.
At 18, most 18-year-olds, I would not say, I would see that vision in them. They're worried about, enjoying life, being an adult, and he saw something in you that was inspiring, I guess.
Yeah, for sure.
Awesome.
And so 6 months went by, and, worked with him for another 2 years. No, I was with him for about 3 years, actually. And so, at the end of that, I went to start working with a cosmetic dentist in Las Colinas. And
okay.
So, again, didn't know anything besides surgery. And she did a lot of, cosmetics and general dentistry. And so I was there for about 3 months. And then I started out as her sterilization tech. So I was just cleaning instruments, helping set up rooms. And then I started assisting one of her associates.
Yeah.
And then within about a year, I was her lead assistant and was running the whole operations in the back.
Wow.
And so, again, with her, she asked me as well, have you ever thought about becoming a dentist? I said, well, no, but you're the second dentist that's told me, so maybe I should look into it.
Right. You've got these huge people that have been in the industry for a long time kind of pushing you along.
Yeah, for sure.
That's wonderful.
So, here we are 20 years later.
20 years later?
And been a dentist now for 6 years practicing, and then 4 years of dental school, so about 10 years now.
Wow. And you learned a lot, though, in those positions that you had with your mentors.
Correct.
Would you say?
Yeah.
To get into the industry so young, do you regret any part of that, or are you glad that you had someone push you and develop you so young?
Well, I'm glad that they saw something in me and they said something to me and they encouraged me.
Yeah.
My parents, they didn't have a college or high school, history or background. They're both from Mexico and immigrants to this country. And, my dad's a commercial fisherman. He owns his own shrimp boats, oyster boats.
Wow.
And so he taught me early on that, we're not here just to, get by. We're here to work hard. And so I started working with him every summer from the time I was in 6th grade all the way until I graduated high school.
Oh, wow. So that work ethic was kind of instilled in you from the start.
Yeah.
That's a wonderful thing.
Yeah. I always remember this. He told me when I got to like middle school, I was, was wanting name brand clothes and
Of course, right?
this and that. And so he told me, I wanted some Nike shoes, and he's like, son, you want some checks on your shoes? I was like, yeah. He's like, we need to start making your own checks so you can get them. And I said, okay. And
Your dad had that entrepreneur mindset.
Yeah. So, started working with him every summer. And then when I graduated high school, I moved up to the Metroplex. And then I did a, 6-month dental assistant course. And then from there, just got into dentistry.
Wow. That's incredible to be in it 20 years. And would you say that you've been successful in your career?
I would say so. Yeah.
So what can you describe kind of one transformation that really moved you in this industry? Is there a certain patient or a certain moment that you're like, you know what, I'm not going to be what I would call a PCP dentist, a dentist you go to get your cleanings or your checkups, but what inspired you to do cosmetic dentistry? Was it a single patient or was it?
So it started whenever I was working with a doctor as an assistant.
Yeah.
And one of the transformations I remember is an individual who had, gone through relationship that wasn't very, beneficial to her. And so she was going through all that, and we were able to, just transform her smile. And it was just touching to see when we finished how her smile just glowed in her face. It just everything changed in her. And so that kind of sparked something in me. And then from there, now with my practice, like the first few transformations that I did on my own, and I still remember them. And so, yeah, it's something that I really enjoy.
You get a sense of completion and pride from it, it seems like.
Yeah, for sure.
And one thing I love about you and your practice is you're not just kind of in it for what you do. You enjoy the whole circle of it, meeting the people, having a relationship with them, and truly caring about what they want to do with their life. I mean, in general, your smile is everything, right?
Yeah, for sure. So, when you get to our office in the lobby, there's a frame that says every family has a story. Welcome to ours. And so, and around it, I have pictures and photos of patients that I've done their smiles, and I could tell you each and every individual's story, and I get to know the patient, so they become part of my family.
Yeah.
And so since I live in the Midlothian as well, and I practice in Midlothian, and I would say about 95% of my patients are from Midlothian.
So you're a celebrity in Midlothian almost. I know we used to do field trips with my kids to the local dentist. We live kind of in a rural area, and everyone knew him.
Yeah, for sure.
And it's nice, though, right?
For sure. Yeah, because, we run into them in Kroger or Walmart, or, having dinner. And so, it feels good to see a patient, and then they come and shake your hand, or, they say, oh, this is my dentist or whatnot.
Absolutely.
My kids love it.
Oh, they love the attention you get from it?
Yeah, they think my 6-year-old daughter, we were having dinner, and had a patient came up, and, I had just done some work on him and got him out of pain. And, he was like, oh, this is my dentist. And my daughter was like, when he left, she was like, Daddy, you're famous.
Oh, that's got to give you so much pride, though. It's because of the relationship you make with them, though, right? Sure. I think the majority of businesses that succeed, it's because they create relationships with people. Yeah. Would you agree?
Yeah, for sure. And then with the kind of dentistry that we do it's more boutique style, and, it's personalized. We want to get to know the patient, want to get to know their why are they wanting to smile, and not just, so I can plan around it, and just, we help them, patients when they're doing a full mouth rehab. It's not just a one appointment, process. It's a multiple appointments. It can span up to, depending on, what we're doing, can span up to 6 to 12 months.
Wow.
And so we get to know the patient really well, and I give them my cell phone number so they can contact me if they need anything. So it's very personalized. For sure.
It's a major undertaking. I mean, those are major surgeries to me. I feel like a lot of people have a fear of the dentist and cosmetic dentistry, especially because you're doing a lot of surgeries, right?
Correct. Yeah.
And you've been in the practice for a while we're talking about that. You've, in a small town, you have some pretty advanced clinical techniques for a small town. I wouldn't say dentist. Would you call you a cosmetic dentist or a dentist?
Well,
Either or.
either
Okay.
or, yeah.
So what inspired you, and how has your technique help you advance and get to your goals, your business goals, all of it?
For sure. So, like you mentioned, for a small town, we do have a lot of advanced technology.
Mm-hmm.
We do offer the latest, techniques and protocols. It's been something that I've focused on very heavily. The practice has been there since 1994. I took over in 2020, end of 2020, early 2021, and there was some technology there, but I renovated the practice and brought a lot of the new technology, like such as 3D printers, 3D scanners. We have photogrammetry as well for dental implants. And CAD/CAM software to design the smiles before we do anything on a patient.
Wow. It seems like you have a knowledge of, from top to bottom, everything that's going on, whether you have people helping you or not.
Yeah, for sure.
So people know that when they come in, they're going to have that personal touch with you, and they're going to have the best equipment. Yeah. Are those standard equipment options in the industry? Because I've never heard of a dentist having a 3D printer. I'm sorry.
Yeah, for sure. So, it's becoming more and more common, but with the training that I do have, it's something that's very essential. I'm able to utilize it to print models so I can show patients, 3D like models of their teeth and where we're going with simulations. I have a software called ExoCAD, which is a CAD/CAM software where we incorporate photos of the patient, 3D scans of the patients, and X-rays, and we can put all that together, and I can do a smile simulation for the patient
before they even have any surgery. Yeah. That is incredible. Your response from your patients, is it overwhelming when they see it?
Yeah, for sure. Especially if they're missing a lot of teeth and they haven't had teeth in a while. When they see that, they most patients get teared up and
I'm sure
get excited.
Because that's an insecurity you're taking away almost. For sure. Oh, that makes me want to cry, honestly. So you recently hit your $1 million revenue mark, right? Or you've grown past it.
Yeah.
That's wonderful. So what would you say was your key strategy in reaching that goal, and what techniques did you use as you went through the growth phase of your business to get to that point?
Yeah, for sure. So, doing general dentistry, you can make a fairly decent living as a dentist, as a general dentist.
Mm-hmm.
But, if you want to do more and have a bigger impact, in the community and have a more, I don't want to sound like.
It's okay.
Just have more fun with dentistry.
Actually enjoy your job when you come to work every day. Yeah, for sure.
It's doing the advanced dentistry is where it's at, And so, in order to get to this position of doing the implants, doing the cosmetic dentistry, you have to do a lot of training and invest in yourself. So I've invested a lot of time learning from, some of the best dentists out there for cosmetics and for just, routine dentistry, just making sure that when I do the, treatment on patients, I'm able to offer them the best. One institute that I graduated from recently, or about a year ago, is the Koi Center in Seattle. And so that's been one of the biggest, influences in my in guidance and to my career as a comprehensive care dentist.
Wow. So that was kind of an optional education for you, right?
For sure.
And what were they focusing on?
So it's more on comprehensive care.
Okay.
So it's evidence-based dentistry. So it's based off of the research that they do. And, what I love about it is that Dr. John Coyce, who's, the founder of the institute, he's the one who teaches the course. And
wow,
it's in depth. He called, when you go for the first course, he starts off by saying this is a graduate program for practicing dentists. And it is, you go there for a week at a time, and you're there from 7 in the morning till 5, 6 o'clock in the evening, and for 5 days, and he's just lecturing,
Learning.
and so you have both didactic and hands-on, and so it's been one of the biggest influences on me, and it's helped me, get to where I'm at, understanding how the treatment plan, understanding, the risk of a patient, because some patients come in and they're like, I just want to have a pretty smile, but there's a lot of other things associated with it. And so, that's been one of the biggest, game changers for me is knowing that, having the security and peace of mind, knowing that I'm able to treatment plan properly and not, be wondering, okay, is this the right treatment for the patient?
Right. So you're able to educate the patient on the ramifications of what may or may not happen, so they're fully aware.
Yeah.
And I think anyone, whether you need it or not, anyone, when you have a doctor going inside of your mouth to make changes, I want to know every aspect of what's going to happen. Yeah. And I think I'm so glad you touched on this, because I feel like, and correct me if I'm wrong, a lot of, especially the medical industry in general, a lot of people go through college, they go through med school, they go through, attorneys, all of those things. And then they're like, okay, this is my profession, and school's done. But you have the willingness to continue to educate yourself. Would you say that's what differentiates you from other dental practices?
For sure. So the state of Texas, I believe, requires like 25 hours of continuing education every year for dentists.
Really?
I do about 100 to 150 a year additional training.
See, I'm going to come see you now just knowing that, because the world is ever changing. Digital's changing. The capabilities are changing. The risks are probably changing. And so knowing that the person that's helping me is educating themselves, and then in turn telling me the truth and honest, literal information, I think is why you guys are kind of top notch for your area. Go ahead.
Yeah. So, one thing that I learned at the Koi Center, this is another quote that he mentioned was, I forget who the actual person who said it, but he mentions that you do the best you can until you know better, and then when you know better, you do better. And so
I love that.
And so that's when he said that really resonated with me, which is why I was there, because I want to do the best for my patients. And then there's time, when you go to dental school and you do your formal training, they only teach you so much, the basics pretty much. And so when you get out, you're just doing, they call it dental school dentistry, which is bread and butter, crowns, fillings, cleanings, root canals, just
all
the basics.
the stuff my kids would need done.
Yeah.
Right.
And so, and when I got out, I knew there was more to it because of my experience as a dental assistant, the previous years that I worked. And, when I got out and treating patients and doing some smaller continuing education, it was eye-opening for me, because, the more you learn, the more you realize that you don't know. There's so much out there. And like you said, dentistry is always changing. And if you want to be, up to date with the latest protocols and techniques, you have to continue to do research. You continually learn to be better. If not, you stay stagnant. And
in any industry, right?
Yeah,
because you have to grow. I'm still learning things every day.
Yeah, for sure.
So, with that being said, you're great at what you do. You have the best technology. You create wonderful, lasting relationships. How do you market that? On what platforms or what campaigns have you used to bring in clients that understand what kind of care you're going to deliver to them?
So Google has been one of our biggest aspects. The reviews have been another thing. And the majority of my patients are referral based. I have a lot of husbands and wives that have done their smiles. Patients bringing in their families, their parents and whatnot. I have a patient who we did her implant surgery, and a couple of weeks later she brought her husband, then we did his, and then now we're working on her parents, her mom and dad as well.
Wow. So you would say, and those are the best types of advertising is referrals, right?
For sure.
Because there's a quality of care there. And I think networking would be a huge part of any business development, but to have those referrals, those are quality. But when you're in a small town, how do you expand? Google is a great platform for you.
For sure, Google, and then Facebook has been another good one for us. A lot of my patients' demographics is like baby boomers, and so a lot of them mention that we run some meta ads, not a whole lot, but just some, and we'll boost like testimonials, we'll boost those, and then we'll do some stuff on Instagram as well, and so but by far the majority of patients that are seeking this kind of treatment are older patients, and so
baby boomers,
yeah, and so they're on Facebook more than like Instagram or any of the other ones.
Mm-hmm. So you create great relationships, and you're kind of in a small town. How does your staff because you want referrals, right? You want also to have a staff that's going to be your advocators. Are you very strict with them following procedure, or is your staff also a team culture? Because I think that's important in any industry. You have to have a good team and a good environment to run a successful business, would you say?
Yeah, for sure. And especially with this kind of dentistry, it's, like I said, more boutique style. So, patients, you asked about systems. They follow systems and protocols. We do training, and so that we can all be on the same page. One team, one voice is what I tell them.
That's wonderful.
So one of the biggest, I guess, assets that I would have is my wife. She's actually a dental hygienist by trade, but when we bought this practice together, she started learning the business side of dentistry, and so she helps with all the training. She helps with setting up all the protocols and systems that we have.
Wow.
And how we communicate with patients and all that. She helps with presenting treatment and whatnot.
Wow. She's literally your second half.
Yeah, for sure. She focuses on that so that I can focus on the clinical aspects for the patients, and I can just dedicate my time just to them and offering the best quality care that I can.
And that's a game changer. So it's not a family environment; it's a family, literally, which is absolutely wonderful. I know that can be hard sometimes, but it seems like you guys do it flawlessly.
Yeah.
So, you're here. You've reached your goal. You have the staff you want. You have the referrals you want. Where would you say your business is in terms of build, launch, growth, scale? Because we work off of that methodology, right? Sure. Where would you say you are, and where are you wanting to go?
So, I would say, like, for the build part, we're still building, still tweaking things, making things better, improving on systems, improving on, getting the word out there. The growth, we're in the growth phase now. I want to do more of this dentistry. We want to be able to touch more patients' lives and help change lives. And so that's where we're trying to head. I'm gonna give a shout out to my son. He's graduating this weekend, and
congratulations! You did a good job, Dad and Mom.
So the reason why I bring him up is he just let us know that he wants to be a dentist as well, and so
I bet you're so proud.
Yeah, for sure. And so I want to grow the practice so that when it's his time, he can come into a successful practice and just be a part of the journey and the legacy that I'm trying to build.
Just like your dad did, taught you that work ethic, and you're just trickling it down. And man, to have a family practice like that and to be able to leave a legacy or maybe open another facility would be amazing. Sure. To have the quality of care that you give, because I don't know about you, but I know a lot of people that they're terrified, and just knowing how careful you are would really, really comfort me as a person, because sometimes you feel like, I don't know if you've experienced this or heard this from other clients, but it feels like they're just pushing cattle through sometimes, like you're here, you're there, and they don't even remember your name.
Yeah, for sure.
So in 2 to 3 years, what's your vision with your son graduating now?
Yeah, so it takes about 8 years go through undergrad and dental school. So, have about 8 years to have everything flowing to add them to the team. But within the next 2 to 3 years, we plan on, just incorporating some more procedures that we can do. Actually, I recently added a periodontist who's a gum tissue specialist to the team.
Wow.
So she's a dentist who I actually worked with in the past as a dental assistant, and we connected on social media. She was she's been seeing some of the work that I've been doing, and so she's like, "Hey, I want to work with you."
Yeah, on Instagram, it looks like you're offering complimentary consultations right now.
Yeah, correct.
Wow. So what types of procedures are you offering, consultations for, or what are you offering most of the clients that are coming in and becoming a client for you?
Yeah, for sure. So, if you reach out to us, DM us, we'll offer free consultation for cosmetics or implant surgery. I'll sit with you for about 30 minutes or so, just kind of briefly hear what your goals are for your smile and what you're trying to achieve, and then kind of give you a quick summary of what the process is, and then from there, we'll do a couple of photos so I can kind of walk you through, and then just go from there. See if we're a fit for each other, and see if this is that something that you're interested in, and then we can go from there with all the records and all that.
Wow, that's wonderful. So you kind of give them an image of it in a consultation, and some people don't know if they need surgery, right?
Yeah.
That's what that consultation's for.
Yeah, for sure. Yeah, because we've had a few patients who call and they're like, "I need to get all my teeth out," and then we get them in, and when they show up, they have nice, healthy bone. Yeah, it's been a couple of years since they've had a cleaning, but we can do a cleaning, do some whitening, and there you go. You're gonna have a new smile. And so, yes, I do a lot of implant surgery, but I always think, can I save the teeth? If I can,
yeah,
why not?
Is that better for overall health?
Yeah, for sure. Overall, if you can maintain teeth, your natural teeth, it's nothing like there's nothing like having your natural teeth. And so, yes, I enjoy doing surgery, but if I can help with a patient, the long run, why not?
Oh, that's wonderful. So how can our listeners or anyone interested in an internship or learning more about your business, how can they reach you? What platforms, and do you have a website?
Yeah, so the practice website is DFW Smile Design. And then we also have social media platforms. So, on Instagram, we're at DFW Smile Design for the practice, or my personal Instagram where I post more of the in-depth surgeries and stuff like that. It's at Dr. Noe Jaramillo. And then on Facebook, we have just type in aesthetic and implant dentistry.
Perfect. And I'll list them at the bottom of your bio here. I always end with one question. If there is anything you could have told yourself in the very beginning when you started your practice, what would it have been that you wish you would have known?
Oh, man. I would say probably HR.
To really refine that and understand it?
Yeah. Just dentistry is easy. That's what I trained for. But, just managing people has been the thing that I've had to learn the most. It's not something that you learn or comes natural to everyone. So
I agree.
Just trying to figure out myself, leading myself, and so I can lead my team, and being able to express what is that I'm trying to achieve, so that they can see the vision as well. And so that's one thing that I would say, if you're gonna own a practice or a
any business, right?
Yeah, just
people are hard.
Yeah, and then just having clarity in your vision, and that's, I recently started doing journaling and that's something I've never done. And
self-development, right?
Sure. And so one of my mentors is Jeff Buski, who runs an organization, group called Limitless Dentistry, and it's a group for male dentists, and so he goes through leading yourself, and you know, you focus on 4 areas of yourself, like body, being, balance, and business. And so, you know, it's been very, very eye opening and game changer for me, because it's helped me, you know, gain clarity as to what I want to be, and the legacy that I want to leave as a dentist, as a person. You know,
Absolutely. Would you say to any business owner out there or entrepreneur out there that having a mentor or having a group of people that have been successful or are great at what they do is important in growing your own business?
Oh yeah, for sure. Like having a group, like someone outside of your team, like, because you know your team is gonna always say yes to you because you're the boss, right?
Of course.
And so, but just having a group of people that you can network with, mentor, a mastermind group, or just, you know, friends that are out there, you know, just,
to give you honest insight,
for
right?
Sure.
No
So,
filtered is what I like to say. For sure.
So like with me, one thing why I seeked a mastermind group was I was at a point in my career where, you know, I was hanging out with my dental friends, and got to a point where I was the smartest guy in the room constantly. And then I'm the one that's getting, you know, asked questions about certain procedures, or how would you handle this, or, you know, how would you handle this situation with your team member or a patient. And, you know, you get to a point where you're like, man, like, I want to ask questions. I want to sit down and listen and hear, like, what.
Right. You don't want to get stagnant.
Yeah. Yeah. And so, you know, I just started doing research, and then I found this mastermind group, and then, you know, it helped me out a lot, because it starts with, like, dealing with the facts. You know, got to be real with yourself and the facts.
Yes.
And so, you know, just putting it out there, and, you know, writing your goals and what is it that you're trying to achieve, and getting clarity and mindset.
Yeah, I think that personal growth really impacts your business growth. For example, and I don't know if you do this as well, our CEO, when he hires everyone, he makes sure to let them know that I don't require you to read these self-development books or anything on the side, but I encourage you to, and I want you to develop yourself internally and at work as much as you do in business. And I think that's very important to have that balance, right?
Yeah, for sure.
You agree?
Yeah.
That's wonderful. Well, I really want to thank you for coming on the show and helping people see that owning your own business and being in dentistry isn't all about numbers. It's about people too, right?
Yes.
Thank you so much. And I hope to see you in 2 years when your son's all working his way through school.
Yeah, for sure.
Awesome. Well, thank you, Dr. J. And to all of our listeners out there, we'll see you next time on Market It with Atma.